Many of my patients suffer from abdominal pain and flatulence, and almost always the cause lies in the gut. What can you do if you suffer from abdominal pain or flatulence? It is very important that you go to visit a doctor. You have to clarify this pain because we have various organs in the abdomen. Abdominal pain could be gallstones. It may be an ectopic pregnancy for a woman. There may be an inflamed diverticular on the colon. It could be harmless flatulence, but we must start with an accurate diagnosis. It is important, especially with long-standing complaints, whether they're at the top of the stomach area or in the lower abdomen, to clarify them in detail. This requires examination, possibly an ultrasound, of the abdomen, or even a gastroscopy or a colonoscopy. Without these clarifications, it is not possible to get an accurate diagnosis. If now all these clarifications have been made and nothing is found, and patients like these often come to me, I am the last hope for them. I don't like that, but I hear that a lot. But I have to be sure that all other diseases, including tumours, cancers, etc., are excluded. What I also hear often is that the gastroenterologists who have tested and have checked the intestine write in the report, nothing is found, everything is fine. And yet, people have bloating and abdominal pain. Now, when I know it has nothing to do with the organs, only then will I make the diagnosis of an irritable bowel syndrome. And friends, this diagnosis is so common. We probably all have gas or diarrhea here and there. This is nothing special. When diarrhea lasts for 2 days because you ate something spoiled, no problem. After this, it's back to normal. But if someone has diarrhea every week during 5 years, this is not normal. And that's where we have to look at where it's coming from. And as I said, irritable bowel syndrome is an everyday diagnosis in my practice, sometimes even several times a day. I see it and I respond to it because I ask different questions. Some of these questions I have started asking every one of my patients. Maybe someone comes because of a skin disease or because of fatigue. I specifically ask about digestion and the function of the gut. If these people confirm that, then I know there is an irritable bowel syndrome here. It's something so basic and obvious, and unfortunately, there are many doctors who do not recognize irritable bowel syndrome. They even say that diagnosis doesn't exist. Others say it has to do with psych. It is all a psychological problem. And I can tell you, irritable bowel syndrome is a well-researched disease which we know a lot about now. We know exactly what happens in the gut. The cause of irritable bowel syndrome is often a food intolerance, firstly milk, and then secondly wheat. And if we eat something incompatible, the intestinal mucosa begins to recede. The villi become thinner and the surface area of the intestine becomes smaller. When you have flatulence, gases are created in the intestines, and in addition, histamine is formed. This histamine is formed in the intestine. You may know histamine from hay fever. There, the nasal mucosa is swollen and it creates fluid. This is exactly what happens in the gut, in the case of irritable bowel syndrome. And if you now drink a glass of wine, which also contains histamine, it overflows and your complaints and sufferings increase. It is important to know that with an irritable bowel syndrome, too much histamine is produced in the intestine. Well, how do we treat it? It comes down to this. What do I do if someone has a diagnosis of irritable bowel syndrome? The treatment consists of 2 phases. In the first phase, we need to lower the histamine, and the inflammatory processes in the intestinal mucosa must be reduced. And in the second phase, I need to rebuild the gut properly. I have to make sure that the mucosa absorbs all nutrients again, and that the microbiome, the intestinal bacteria, get back on track. I'll explain how to do that in another video. Here below, you will find the link to more information and therapy plans. And now I wish you the best and goodbye.